Hi, I'm Dr. Jan Jaffer, and this is GotTeeth, a patient-centric monthly podcast featuring local health experts.
Hello, I'm Nitin of TREC Dental. Today on GotTeeth, we're going to talk about one of our favorite topics, social responsibility. Giving back is a core value of TREC, and here to talk about it more is our usual host and CEO of TREC Dental, Jan Jaffer. It feels good to start off a new year with a topic like this, doesn't it? Tell us why social responsibility is so important to you, Jan.
You know, I think the organization has always been built on giving back and helping others. I mean, when you get into, I think, even the medical community and being a dentist or an assistant or a hygienist, you want to help people. And helping is part of how TREC was built. And so I think we've got some great opportunities to help, and people need things. You know, I mean, we're looking around both locally and internationally, and there's a lot of help that's needed. And what we also know is that by giving back, there's something that we receive from that, which I think is really important to look at, because, you know, the giver is also getting a benefit when helping others.
So it's great to be able to involve your teams in social responsibility, isn't it? Tell us more about that.
Well, you know, we usually have a monthly or a bi-monthly challenge that involves social responsibility. So, you know, we do stuff for breast cancer awareness, we do stuff for the partnership walk. And so we always try to make it easy for our teams to get involved. You know, we know that people generally have time or money, not both. And so we try to make it easy for people to, you know, just volunteer and give us some hours. So they won't need to necessarily make any donations, but they can, you know, give us hours. One of the other ways, though, is through donations. Obviously, you know, I mean, organizations need money. And one of the things that TREC does is it obviously donates a lot to different organizations, but we also have an employee matching program. And so any employee that donates money to a charity, and Canadian charity, TREC will also match their donation up to a certain value. So that's another way of doing it. And then one of the, you know, other fun ways of doing it is getting out there in the community and doing stuff. So recently, a group of us went to the food bank and we helped, you know, organize food. We do stuff around the communities all the time. And then a bigger one where we get to help kind of the rest of the world is on mission trips. And so we actually get to go do dentistry around the world.
We wanted to focus a little more on those mission trips. Now that COVID is at least a safe distance, if not firmly behind us, you finally, after many years, have the opportunity to go back on mission trips, and they're right around the corner. Tell us about the trips you've been on in the past.
Yeah, so I've been fortunate enough to be on, I believe, 14 mission trips now.
Wow.
And so 10 have been to Guatemala, and then I've gotten the opportunity to go to Ecuador, Peru, Tibet, and Morocco as well. But Guatemala has always been our focus. We've spent a lot of time down there, and fortunately, in exactly a month from today, we take off and we get to go to Guatemala again.
Wow, how exciting. What prompted you to get involved in mission trips in the first place?
You know, it was somebody that pushed me. So actually one of my partners, Dr. Reddy, who you know quite well, prompted me to, you know, she said, hey, why don't you join me on a trip? Let's go down to Guatemala. She'd already been down a couple of trips, and let's see what's possible with our hands and helping. And so, you know, the first one was an eye-opener for me. I mean, I'd never done anything like that, and it really got me excited about going down and doing it again. And ever since, apart from, you know, the COVID years, every year it's been at least one, if not two trips a year to get down to Guatemala and different areas to help.
So how many people go on these trips? Like, who's involved? Is it all strictly dental people who go on the trips?
So in our situation, mostly dental people. We usually have 20 to 25 people on the trip. And so we'll have dentists, we'll have assistants, we'll have hygienists, and then we'll have a few other people that help us out. And so there is the opportunity for people that are not in dental to get involved. They can help with sterilization. A big one for us is somebody that speaks Spanish. You know, my Spanish is not that good. Most of the docs that come, their Spanish is average at best. And so having a translator makes a really big deal. And so we usually take a couple of translators with us as well.
And how does it all work down there? I mean, you have clinics that you work in. How are you able to, because you're not really in major centers, correct?
Absolutely. So the place that we're going this year, and the place that I've been to, I think 6, 7, 8 times now, is called Comentencio in Guatemala. And it's in a mountainous region, you know, 6 to 10 hour drive from Guatemala City, depending on traffic and what's happening out there. And we're in this area that's quite remote. It's a bunch of farmers and villagers and different villages that come together. And so no, there is no clinic in that area. There's actually no dentist in that area. And so we go set up and we take everything in. It's a little bit like a MASH unit of sorts. We take all of our supplies, all of our units, and we go set up in a gym, really. And we set up a makeshift clinic that functions really quite well.
I have had the opportunity to go to Competency and I've seen what it's like, and obviously a lot of planning has to go into making it work. You've got to take compressors up there and lines, and I mean that's the opportunity obviously for non-dental people who, especially those who have a technical background or good with their hands.
Yeah.
The MacGyvers, we like to call them on these trips, because then they're able to pull all that together. But how are you able to make it work, with all of that logistics involved?
I mean, it's a lot of planning. I mean, we're fortunate that there's a trip leader that we have that's actually lived in Comey. So he actually went down and spent some time down there. And so he knows a lot of the locals, and we've set up a system. Going back there this many times, I mean, there's a system and there's a ton of planning. And I was just on the phone today with Shane, who is our trip leader, just about how many days of clinic we'll be doing. I mean, what supplies we need to take down. I mean, we literally take most stuff with us. It just makes it easier. Can we get stuff in Guatemala? For sure, but trying to get stuff, the supplies could be different, what we use could be different. And so we really take a lot of stuff with us, and then we have stuff down there. And again, you were fortunate. I mean, how many years ago were you in Comey with us?
That was, that'll be 10 years this October.
Yeah. So you've got an experience to see that, I mean, we need sterilizers. And they don't always work, and so we need people that can fix the sterilizers. But we need to take toothbrushes down, simple as that. We need to take fluoride, we need to take burrs, we need to take, filling material, bond. All that stuff has to be transported down there. And, we want to be very careful with what we take down. We're very particular about taking stuff that we would normally use in our own clinic. So stuff that we're taking down is not below the standard of care of Canada. It really is at the same standard. If we wouldn't use it on our patients in Canada, we won't use it down there. We've had a lot of dental professionals ask us, hey, we've got some expired product, would you be willing to take it down and still use it? It's still good. And the short answer is no. If it's expired, it doesn't come with us. Even though we know it's probably safe to use, we're just not willing to take those chances. And so the quality of care down there, although it's set up as a MASH unit, is really quite similar to the quality that we'd give our patients here at home.
Right. I mean, it's good that people are willing to donate. Obviously, their heart's in the right place, but we don't want to compromise the standards, obviously.
Yeah.
What's it like? What are the days like there, and what's the interaction with the people that you're helping like?
Yeah. So I mean, I'll run you through a quick itinerary. Like we'll fly down, we'll spend a day down there getting some supplies that we can get locally. So we'll go to Walmart and we'll pick up stuff that that we can still get there, like paper towels and stuff that wouldn't make sense to transport down. It takes us about 2 days to get to the location we're in, so we overnight along the way, and then we spend a full day setting up the clinic. We're lucky that our MacGyvers this year and the last couple of years, they know the system inside and out, and so they'll go down a day or two early and they'll get the clinic, the majority of the clinic set up. So the compressors will be set up, lines will be set up, units will be set up, and so when we go in, we're just setting up the dental equipment portion of it, or the supplies. And then we get somewhere between 4 and 7 days of dentistry in there, usually 5-6 days of dentistry that we do. And they're long days. We're in clinic, we're usually up around 6 in the morning, get some breakfast, get to clinic around 7:30, and by 7:45, 8, we're running, and there's already a lineup. I mean, that's probably the fulfilling part, but also the challenging part is seeing those lines of people that are just, they're trying to get in. And so, the lines start sometimes the night before, honestly, at least the morning of. And, we'll treat as many people as we can. The good news going into Comey is we have some locals. So we actually, through Dentistry for All, that's the organization that the Guatemala trip is with, we work with two organizations, Dentistry for All and Kindness in Action. This trip is with Dentistry for All, and we actually do have somebody that we sponsor to be down there year round to help in the schools and to treat people with just fluoride and education. But they'll have a list of people, and so we'll have about 60 to 70 people on a list that will get priority because they've been pre-screened, and then the people on the line get seen after that. And so it's long days. We're there till 5, 6, 7, depending on what it is, and we'll treat as many people as we can safely, and so that we're doing the best quality work that we can.
Right. And I mean, when you see the people and are able to help them, and I know you obviously provide them with some basics as well? What's that like, and how do they react?
It's amazing. I mean, honestly, helping these people out, being in the area that they are, they're extremely thankful. I mean, they are so happy to see us there, and they've gotten used to us being there. And so the challenge that we're expecting to see this time is that it'll have been 3 years since we've been there last. And so what is that need looking like now? Because they won't have had somebody there. But they're very respectful, very thankful. I mean, they know we're in the city. They're there to make our lives easier when we're there, to try to help us, treat as many people as possible. But they are truly very appreciative of what the things we're doing for them.
Must be very well received.
It is. I mean, trying to create something that's systemized, that can be done over time, that continues to stay successful is always the challenge. And a lot of the challenge down in these areas is, teaching them to brush their teeth, just simply that.
Yeah.
And we've had people come in and say, well, can we leave them some paperwork? And one of the things that you'll realize when you get down there is that some of them can't read. So leaving paperwork behind is really not terribly useful. And so that's why having that local down there that's able to go to the schools, it's able to go to the communities, it's been trained to teach people how to brush, floss, obviously, if we can, but really brush their teeth, and just the use of topical fluoride, because they have no fluoride in their water. That's obvious. So putting some fluoride on the teeth. I mean, one of the things that we try to do is, even for the younger kids that we may not be able to treat because of their size or because of some of the challenges, we can at least use fluoride. And the nice thing about the trips, again with DFA, is on this trip we should have 3 pediatric dentists and 3 general dentists. So really being able to see those 2, 3, 4, 5, 6-year-olds that are challenging to see without having that specialty and being a specialist, be taken care of because of the pediatric dentists that we have on the trip.
That's wonderful. And obviously it's so much better when you can get them when they're that young and be able to hopefully start a lifetime of good oral health habits. It's not just toothbrushes or floss that you're able to give the folks, which obviously it's wonderful that you're getting donations from some of the vendors for that. What else do you typically try to give them when you're there?
So one of the things that's actually really helpful for the people that are there are shoes. It sounds so simple to us, but just having a good pair of shoes to wear so you're not, walking without shoes. And so one of the things that we try to take down every year is, gently used kids and small adult shoes. Again, what we don't realize sometimes as we go down there is that the size of an average person that lives up in the mountains is smaller than the size of an average person in North America. And so, kids' shoes into small adults' shoes are really helpful because they don't have shoes to wear in many situations, or at least not well-fitting, or shoes with soles. And so one of the things that we look for, and when we look at opportunities for people around us to help, for patients to help, for community to help, one of the things that we're going to be doing over this next month, because we leave first week of February, I believe February 2nd or 3rd is when we're leaving, is for shoes. And so, one of our asks to our patients or to anybody listening to this, podcast is, if you have gently used children's shoes, please feel free to drop them by the office. We did this a couple of years ago, and we got, I think, over 400 pairs of shoes.
Wow.
And it was amazing. So we get some big duffel bags, and we pack up the shoes, and we take them down with us. And we always try to give them a gift at the end of their appointment, just like we do here at home. The kids get a little prize at the end of their appointment. We try to give everybody that comes to our appointment a little gift. And shoes are the things that they pick the most. Now, there are other things that we take down. We take, just kind of fake costume jewelry or other small gifts that kids would use, bouncing balls, stuff like that. But what we find is people will always choose the shoes first if there's enough of them. And so if there's an opportunity, if any of you have, children's shoes that are gently used, they definitely don't need to be new. They'll take them pretty much in any shape that they can get them, but we want them to be in fairly good shape if we take them down.
So again, whether you're patients of one of our offices or live near one of them, they can just bring their shoes into one of our TREC Dental locations around the city, and they'll be more than happy to pass them on to us to be taken down to Guatemala.
Yeah, it'd be amazing if we, the more we can get, the more we'll take down.
Wonderful, wonderful. Lots of hockey bags to be packed pretty soon, hey?
Yeah, we're already getting started. We've got a plan in place to start packing some of the stuff that we need. We've got a supply list that we're that we're putting together now. And so yeah, over the next few weeks we'll have a lot of stuff to put together, but exciting for the opportunity to go back down there. Exciting for, we have half the trip will be filled by TREC people and the other half by US dentists and hygienists and assistants, and we have one pediatric dentist coming from Halifax, and so it's truly a North American trip that's going to go down, and then we'll even have some locals down there that help us out.
Fantastic. Well, that's great, Jan, and all the best.
Yeah, appreciate it. Thanks.